allow me to present this role of hospital linen in the clinical environment. As I present, definitely this is the reality, what is happening in Rubaga Hospital as regards to hospital linen. Hospital linen plays a crucial role in promoting hygiene. Hygiene has been observed. Safety and comfort within healthcare settings. Beyond providing a sense of cleanliness, definitely everyone is appreciating cleanliness cut across. Well-maintained linen directly contributes to the prevention of cross-infections. Definitely, according to the surveillance, there is really reduced hospital-acquired infections in Rubaga Hospital. There is also patient satisfaction according to the surveillance. The staff safety has been observed. Sincerely, for several years, we have not had a staff acquiring infections from our linen as regards to skin infections. This presentation underscores the operational and clinical importance of linen management in safeguarding the public, especially in the risk environment such as operating theaters, intensive care unit, emergency OPD, dialysis unit, neonatal wards, and labor suit. Whoever goes there, whoever is admitted, any staff working there is approved of safety. Linen services as protective gear during both surgical and general nursing procedures. It aids aseptic technique maintenance. All staff has been trained and qualifies to apply aseptic techniques, and without linen, we cannot observe. And definitely all our patients will be put at very high risk. Helps reduce post-operative infections, particularly in burns unit, surgical settings, and nurses and midwives routinely use linen in critical care during bed making, bed bath, and repositioning patients who are in critical condition, making it available and cleanliness vital to effective care of deliveries. The hospital's policy of discouraging patients from bringing personal beddings has notably improved the hygiene of care environment. You go to the wards where we provide bed linens and everything, you will find space for nurses to carry out their procedures. It has also reduced the pest infestation as we stopped them from bringing their luggage, such as bed bugs and cockroaches, supporting pest control programs in the hospital. Everything is observed. Despite of having the linen in our settings, we have also to look at the safety of the staff who are handling this linen, which may be a risk to the user and the person who is providing. So we address this issue of safe handling of soiled linen. After use, it becomes dirty or soiled. Hospital staff must handle contaminated linen with utmost caution due to risk of biological, physiological, chemical, ergonomic hazards, whereby biological hazard can also expose the staff to blood or body fluids that can lead to blood-borne diseases such as hepatitis B, hepatitis C, HIV, to mention a few. Physically, staff can also be exposed to sharp objects left in linen as they are carrying out their nursing care. There are some sharp objects that are left in linen, and when somebody is handling linen, sorting and processing can easily be injured, definitely with deep injuries or cuts. Chemical, we have talked about the chemicals we use. Cleaning agents such as chlorine can pose high risk during deep decontamination processes, because we cannot leave linen soiled to go to our laundry before it is sluiced. So this is the nursing procedure whereby we have to train them to avoid chemical exposures. Now it comes to ergonomic issues arise from poor laundry room designs or sluice rooms, lifting heavy sluice linen in bags or containers can pose real musculoskeletal strain or the poor posture. You see long-serving staff standing, bending because of these ergonomic issues. Now we come to the issue of infection control and standard precautions. When we look at all the used linen, it has the potential to pass on infections, either directly or indirectly. So we have to address the issue of infection prevention and control. Preventing cross-contamination requires adherence to strict standard precautions. Definitely, as an accredited hospital, infection prevention and control has developed more than 100 guidelines, checklists, and forms that we use to make sure we monitor all of these processes. So laundry team has been trained in infection prevention and control. So all of these standard precautions, we need mandatory orientation on and continuous training of staff, especially the new staff in linen protocols. Proper hand hygiene. Hand hygiene is a day. Every day we have to remind people about hand hygiene. Much as we get now the outbreaks, we are going to use this linen. But if in the routine practices we do hand hygiene, by the time we get the outbreaks, now people will be of the know how to protect themselves. Without hand hygiene, however much we shall provide adequate linen, clean linen, which will be contaminated by the hands, this must be stopped. And we always advise, train, reorient, and this is really done. We observe proper hand hygiene in the facility. Consistent use of personal protective equipment is a key to protect our staff. Handling linen, processing it, sluicing, the nursing, medical staff must be protected. So, facility management must provide the personal protective equipment like the gloves, we mean disposable heavy-duty gloves, gowns, waterproof aprons, face masks, gumboots. Face masks we can definitely use, face shields. Clear demarcation of laundry zones, clean versus dirty side. This is a must. That's why I think in Africa we are the only facility having an accredited laundry, because we have demarcated. When it is dirty, it is dirty. You don't cross to the clean to contaminate. We are talking about infection prevention and control. Use of labeled and disinfected trolleys for transporting linen to prevent contamination. Definitely want even our clients, as we are transporting this linen, to read the laundry trolley must be clearly labeled, it is dirty linen. Then they know the clean linen is passing. They are assured of safety that they are going to be given clean linen. So laundry trolleys must be clearly labeled. Clean linen must be stored in secure, disinfected cupboards free of dust and paste. Dedicated linen trolleys must also be exclusively clean, containing clean linen and undergo regular cleaning between patients and procedures. This is a routine in our wards. Much as our clients, we allow even caretakers, they always look at us, and we are doing all of this, disinfecting all the working surfaces and these trolleys that are brought near to their beds for the care we are providing. These linen must be promptly and carefully contained after each procedure to prevent cross-contamination. Our nurses are doing this the best way, and even our patients are now have gained satisfaction that the linen we are providing to them is really safe and really it gives them confidence that they will recover well. As we are talking about clean, safe environment, but how do we prove that the linen is really clean for the users? We have two users, our clients and the personnel who are working in those critical areas. Definitely, as infection prevention and control office, we have to carry out environmental surveillance. And then this is under budget to ensure ongoing safety within microbiological surveillance. So we check the entire facility, and definitely for laundry, we take off samples from clean linen ready to be used by the user, the laundry trolleys, those are carrying clean linen, and even go to the wards to check where we store our clean linen before the user. That is infection prevention and control will improve as we take off biological samples. Other areas recommended for future biological surveillance includes ward-based linen cupboards. We are going to include on the scope of this. The surveillance is to be conducted on a quarterly basis, and this is what we do. We have results, and as I say, February, we had the samples taken off from clean surfaces of the bed sheets, gowns, the laundries, and definitely we had no growth of microorganisms after 48 hours of incubation. This is on a record. And so, as infection prevention and control nurse, I'm really happy. I'm satisfied. In conclusion, this presentation clearly affirms that hospital linen is more than a support service. It is a critical control point in infection prevention and patient care. A well-structured linen management system reduces the risk of infections, enhances staff and patient safety, and upholds institutional hygiene standards. Hospital must therefore invest in linen infrastructure, staff training, and continuous surveillance to ensure a safe and efficient clinical environment. Thank you for your time.